Good morning and welcome to the Breakfast News with the Sentinel. I'm Moineetam. Let's take a look at the top stories in today morning's The Sentinel. First, of course, is the news about the coronavirus and the problems that the medical fraternity is facing at this point of time. Health Minister Himanta Biswa Sharma said on Sunday that delay in hospitalization of COVID-19 positive patients from home isolation is complicating the situation and increasing the fatalities. After visiting COVID patients at the ICUs in Guwahati Medical College by wearing PPE kits on Sunday evening, Minister Sharma told reporters that patients in home isolation are developing complications and they are getting admitted to hospitals in critical stages. He further said that even though he didn't initially allow home isolation, pressure from different quarters had forced him to allow such treatment facility in the state. And here is what the minister said: death cases have increased after the health department allowed home isolation. The COVID scene is in a very critical stage. I appeal to all people to adopt the maximum caution. Lockdown will not help unless the people are aware and follow the safety protocols. That is what the minister said after visiting the COVID positive patients in the Guwahati Medical College and Hospital. In fact, the video will be available shortly on our Facebook, YouTube, and Instagram platforms. Now, meanwhile, the number of positive cases in the state has gone up to 1,41,763, active cases at 28,158. Number of discharged people stands at 1,13,133. Death toll at 469. Now, there's more to this particular coronavirus saga. In fact, elderly people with COVID-19 are showing very, very different symptoms, very different from what we have been thinking are the symptoms that gives you an indication that the person has been infected by COVID. In fact, what doctors have noticed as far as the senior citizens are concerned is that they are showing several atypical or unusual symptoms, which often complicate efforts of doctors to give them timely and appropriate treatment. Now, here is what the doctors have said. Even though COVID-19 positive cases are typically signaled by a fever and and an insistent cough and shortness of breath, the elderly persons may have none of these characteristics. Instead, they may sleep more, they might be sleeping more than usual, or they might stop eating, they may seem unusually apathetic or confused, and they might be losing orientation to their surroundings. They could become dizzy and suddenly fall. Sometimes they stop speaking or simply collapse. This is what doctors at the Guwahati Medical College and Hospital have said regarding symptoms that senior citizens are showing when they're getting infected by COVID. And there is data that has been released by the health department talking about the number of death tolls, how it has been rising over the past few days. In fact, Assam registered as many as 147 COVID 19 deaths between September 1st to September 12th. The casualties within the span of these 12 days include patients who were between 14 to 92 years of age. This is data released by the Assam Health Department as far as the COVID-19 related deaths are concerned. And viewers, just like I just read out, if you have senior citizen in your home, then please be aware of these symptoms because they are not showing the symptoms that we usually know are symptoms related to COVID-19. The senior citizens, anybody, people above 60 years, are showing symptoms very, very different from what we usually associate with COVID-19. And for the details, of course, you can go through our newspaper this morning, or you can visit our website, sentinelassam.com, to get more details on all of these stories. Now, meanwhile, the Union Health Minister, Dr. Harsh Vardhan, has said that the coronavirus vaccine might be ready by the first quarter of next year. The minister said that while no date has been fixed for the vaccine launch, it may be ready by first quarter of 2021. That is Union Minister for Health and Family Welfare, Dr. Harsh Vardhan, saying. He also said that the government is considering emergency authorization of COVID-19 vaccination to senior citizens and people working in high risk settings. But of course, these decisions are subject to a consensus. This will be discussed first, and then a decision would be taken on these issues. Now, another factor that has been hitting the headlines these days is the revival of the two paper mills of Assam, the Kachar paper mill and the Nagaon paper mill. In fact, the liquidation process hearing is scheduled to be held today, and we have seen a lot of protests in the past few days. Um, these mills have been shut, one since 2015, and this particular paper mill has been shut since 2017. 2015 is when the Kachar paper mill was shut, and both the mills under HPCL, that's Hindustan Paper Corporation Limited, went to NCLT, that's the tribunal that looks at liquidation of non-performing assets. Now, what the workers have been claiming of the paper mills as is that both these paper mills were very much working fine, and till the day they were shut down was producing enough. But unfortunately, the government decided to send the paper mills to the NCLT, and now the liquidation process is to begin. Of course, the big worry here is that hundreds of employees, they are yet to get their dues. That is the biggest worry as uh, the liquidation process starts, and they are really not sure whether they will get their dues or not. In fact, according to what the workers have been saying, the employees have been saying, is that dues outstanding are as far back as 44 months. That is the kind of money that these workers are expecting. In fact, many deaths have happened in the meanwhile. Now, the Joint Action Committee of recognized unions of Nagaon and Kachar paper mills has dared Guwahati MP Queen Oja. She is the BJP MP in Lok Sabha representing Guwahati, to clarify as to when 100 crore rupees, as mentioned by her, was paid towards the release of HPC Employees Provident Fund by the government. It has also requested the Member of Parliament to clarify as to where that amount of rupees 100 crore has gone. It has requested the MP to initiate a CBI inquiry to find out the money so that the amount can be remitted for the targeted beneficiaries. Earlier, the BJP MP welcomed the state government for requesting HPCL liquidator to delay the NCLT, or National Company Law Tribunal, hearing for a month in the interest of revival of the two mills. This is a strong step from the state government, and it has proved the state government's accountability with a view to reviving the two paper mills that were ailing from the Congress regime's time. The government doled out funds, 33 crore rupees as advance amount for the supply of paper to the government. The government also made an attempt to give a succor to the employees of the two mills by extending 100 crore rupees for the release of their PF money. This is what the Lok Sabha MP Queen Oja had said regarding the package being released towards Provident Fund payments for the employees of the two mills. And now the mill or unions seeking more clarity on where did the money go. 100 crore rupees, where did all the money go? Now, moving to news from the other northeastern states. The Indian Railways is going to start computer based tests for the already notified three types of vacancies from December 15th this year. In all, the railway recruitment boards had notified 1.40 lakh such vacancies for the NTPC categories, level 1 posts, and isolated and miscellaneous categories. This was stated in an Indian Railways release. These are 35,208 for NTPC, that's non-technical popular categories like guards, office clerks, commercial clerks, etc. 1,663 for isolated and ministerial categories, and the details are there in the release, which you can access on our website as well as the Indian Railways website. Amid the COVID-19 crisis that left many jobless across the world and led to a spot in human trafficking, the Border Security Force at the India-Bangladesh border turned savior for 17 people being trafficked to India with lucrative job offers. The BSF rescued these people during 11 operations between June 19 and August 26. These Bangladeshis were held uh, while either being trafficked from Bangladesh to India or vice versa. So finally, BSF ending up rescuing 19 people in 2 months along the India Bangladesh border. Amongst these, 10 were women, 7 men, and 2 children, including 1 female child. Now, moving on to the corona status in the states of Arunachal Pradesh and Meghalaya. First up, news from Arunachal Pradesh. The COVID tally in Arunachal Pradesh has gone up, of course. 151 people, new cases reported in the state, and the total has gone up to 5,961. The new cases of 151 includes 20 security personnel. There are 1,698 active cases, and 10 people have died because of the infection. This is the update uh, of coronavirus from the state of Arunachal Pradesh. Meghalaya recorded another death on Sunday, taking the state's death toll to 26. The state has 1,623 active cases and 55 new recoveries recorded on Sunday, taking the total number of recoveries to 2,075. Uh, the Barnihut police outpost has been closed uh, after one of the officials tested positive. And as far as Itanagar is concerned, Arunachal Pradesh, the Ramakrishna Mission Hospital will temporarily stop all its services for a week from Monday after a spike in COVID-19 cases amongst its staff. So these are some of the top stories that we have in today morning's The Sentinel. Of course, the big news today is that amid all the coronavirus news and the report and the number of cases going up every day, the parliament, the monsoon session of parliament will begin from today and is expected to conclude on October 1st. A total of 18 sittings spread over a period of 18 days. All days, including Saturdays and Sundays, will be working days for the parliament this time round. A total of 47 items, including 45 bills and 2 financial items, have been identified. This is how the business of the House is likely to be conducted this time. And of course, there is going to be many firsts, because what the Parliamentary Affairs Ministry had earlier informed is that there will be contactless entry exit. The entire security program has been changed. The sitting arrangement has been changed. Both the halls for Rajya Sabha as well as for Lok Sabha will now be used for this particular session, where the sitting arrangement will totally look different. All the COVID protocol being maintained, and in fact all leaves and holidays has been put off so that the MPs do not go back to their constituencies. They stay there in Delhi, attend the sessions back to back, so that they do not carry the virus back into the parliament and really cause a lot of issue there. So So Parliament session starting today, a lot of bills likely to come up, and it will be one Parliament session that would be really, really tough for the health authorities, the security personnel, given the kind of numbers that our Parliament sees. It's not just the number of MPs who attend the Parliament, there is a huge number of media personnel too. The media is always there, so that's going to be another tough thing uh, for the authorities to handle. Of course, lot of restrictions already in place. So that's all that I have for all of you this morning. Thank you so much for joining me. Log in to sentinelsn.com for all the news and updates. And of course, find us on Facebook, YouTube, Instagram, and Twitter. News and updates continue. Our videos also will be there across these social media platforms. Till we meet again, take care, stay safe. Goodbye.